You rewrote the Bible of blast trauma. I was reading about it, right?
Okay.
Could you explain to me what a blast trauma is?
Yeah. The effect, it's a wave after an explosion. And of course, it depends how much TNT you are putting in the explosion and what you are putting in the explosion. Because the guys, and I can call them loudly, the bad guys.
Yes.
The guys that don't appreciate life. The guys that have, I don't know what they have in the mind.
Evil.
More than evil.
Okay.
Evil is a simple word. Maybe we have to create together
a new word.
A new word. It's unbelievable. And they're putting in the TNT, in our experience, nuts, nails, rat poisoning.
Red poison.
Rat
poison.
Rat.
Yeah.
R-A-T.
Rat poison.
Poison. You know why rat poison? Because it's on the principle to augmentate bleeding. So if you are not enough injured from the blast, the nails, the nuts, etc., over and above,
Poison.
Rat poison. And in some cases, we are not sure there was cyanide.
Cyanide.
Yes. And now, they choose the bomber that has his HIV, HBV, hepatitis.
Yes.
So you have the combination.
They take out the blood and put it in the...
No, because when he was
explode. Oh,
part of his...
You're talking about the suicide bomber.
No, yeah, the suicide bomber. Part of his body, like bone, etc., is entering to the victims. So, for example...
Oof, man.
Yeah, man. Guys, somebody have to speak about it loudly. We change after we figured that that's going on, we change our practice, and now everybody that are coming to us is receiving vaccination against hepatitis. And if you know that he has HIV, we are treating is as he has HIV.
So make me understand this like a 5-year-old. They're not just putting in TNT, in a bomb, they're not just putting nails, marbles, God knows rat poison, cyanide, but they're also giving it to humans who have
know
disease like HIV.
Yes, they know.
Or hepatitis.
They are choosing them. And from time to time, they are going and they are together with people that, influential people that influence them to be the victims. Because in their mind, they think about that he has HIV, he has hepatitis, etc., etc. So you have the combination how we said evil. So now we have to find really another word for evil.
So these terrorists, right? So once this happens and the victims come to land in your table, right? What does the Bible of the blast traumas tell you? What have you learned? How do you treat them?
First of all, most of the bombers, not of the victims, in the explosion, they explode themselves, and there is no chance of survival that they will arrive to us.
You get the bombers.
The bombers.
Okay.
Themselves.
The blast trauma anywhere in the world.
Yes, it's the same.
If there's anything similar to this happening anywhere in the world, what should the doctors, all right, the first responders, learn from this? What is your suggestion to people in Africa, in South America, in anywhere in Asia, in anywhere in the world? You know, in the Americas, anywhere in the world. What advice do you have for doctors and first responders, Dr. Avi?
I will tell you. First of all, as you said, nobody is immune. Nobody. It can happen in Nepal, India, of course, Paris, Buenos Aires, all over the world. The one thing is, to the first responders, to the EMS, bring them as soon as possible to medical facility, meaning hospital. Don't treat them, don't waste time on the scene. If they are bleeding to death from external source, like in the extremities, etc., put a tourniquet.
Yeah.
Come as soon as possible to the hospital, because the blast injury is it's divided to primary, the secondary, etc. I don't want to go in details about,
yeah.
But what specific to this primary blast is that it doesn't affect your body, meaning you look from outside pristine. No even small laceration, nothing. It's amazing.
Yeah.
The only thing, if you are very, very excellent clinician, you can see from outside a color that you are not used to see. Like, it's not gray, and it's not blue, and it's not white, and it's not yellow.
Yeah.
You know, only maybe Chagall, the famous Chagall, the painter, or Salvador Dali,
Yeah.
can figure this color. I cannot explain exactly. You see, I don't have the
right
right
words.
Yes, and the right, I don't know what, ideas or imaginations. You know, when they're printing these wonderful things that they are doing,
Yeah.
Salvador Dali and Chagall, or the others, it's a special color. And from time to time, because of the blast, take an imagination that the blast produced, listen good now, 3,000 degree Celsius temperature.
Instantly.
You can imagine.
Yeah.
It's unbelievable number, and it's creating external damage. It's creating internal damage. It's unbelievable injuries.
In 1994, you were in Buenos Aires.
Yes.
In the EMIA bombing.
AMIA. It's called
bombing.
AMIA building
Yeah.
of the Jewish community.
Did you? I was reading that Argentinian doctors, were treating people in trauma carts as well. I'm sure you know this.
Meaning?
They were treating people in a cart as well, right? So from the bombing, what learnings did we get from 1994?
I can tell you what I learned.
Yes.
First of all, when we came, the only, first of all, I have to mention, let's speak for a while, for a second, about something happy that
yes,
happened.
Of course, doctor, of course.
For me, we landed in Brazil, and the Brazilian team came back with a cup.
Yes.
So I remember it. And later on, I met Pelé.
Oh, you did?
Yes. And he gave me a shirt with his signature. Pelé.
Wow.
So.
That's great.
Yeah. And that was on the way to Argentina. No, I met him later, but I remember it vividly. As I remember what happened in Argentina.
Yes.
We came, the building collapsed because of the bomb, and I saw people digging, dogs looking for, and we sat there in front of this building, and I said, guys, it's endless. It never stop. You know what? I am leaving the scene. There was 100 meters from there, a hospital that received the casualties. I went there. I told them, listen, I introduced myself. They were very nice, very polite, and they accept me.